Hello friends, hi, this is Vinayak Rengan here. I'm the founder of Search Test, and today I'm very delighted to have with me Dr. Shubham. Shubham has secured rank 5 in the latest INI SS for surgical oncology. So Shubham, how does it feel to be a topper?
It's nice. It's very exciting that I did it because I have not believed it that I can do it. So that was very unexpected to me as well that
I'm
I
sure you
got
did quite
qualified
well,
this.
Shubham. Shubham, tell me a little bit more about yourself, where you did your MBBS, MS.
I did my MBBS from PJ Rohtak and MS from GMC Patiala. I have passed my MS in 2023, and then I prepared while doing my SRship, and then I gave my exam.
So, कैसा था? How was it? Was it difficult preparing with SRship, or did you have enough time? Was it chill? How was the entire process of preparation?
During SRship, it's always difficult. What I felt that was a very difficult job to prepare with the job. You must take at least 2 month break from the job for that for a good preparation.
So you took a
And
2 months break.
nee, I was unable to take that. I took 1.5 months.
Okay, okay,
Yeah,
okay. And I know you used search tests extensively during your preparation, but what
yes,
were
sir.
the search tests which were kind of useful to you overall?
So what I think was I have I have used video lectures as well, but along with video lectures, one must do the question bank of the search test.
So
One
you
must
oncology or general surgery, both?
I did mainly oncology in toto oncology, but I also did general surgery part from question bank. Not
Okay.
video lectures, but question bank you must do of general surgery for preparing the general surgery part for the oncosurgery.
True, true, true. So, how was your preparation? Did you spend more time reading textbooks or was it pure MCQ based?
No, it was what I have read during my post graduation. The textbook was that much only. After that, I was just doing my question bank, and along with that, what are the updates? I was focusing on the updates and what are the mistakes I am doing in that questions while doing any test series or I performing any question bank. So during that, whatever the mistakes, I just open the book and then I used to correct those things so that for a picture memory, I just
Makes
refer the books.
makes sense, makes sense. So, Shubham, one thing which I want to really know is that what textbooks did you use for preparation? Anything else specifically? Did you use, for example, in our search test question bank or to the search test students, we recommend you to read a lot of MD Anderson. Did you actually spend time reading MD Anderson or no?
No, I
No.
really did not spend any on any specific to oncosurgery. No books I have referred, just only the search tab question bank and the video lectures I just referred. And yeah, for that, like common basic books, Bailey and Sebastian Swartz, that I have read,
True, true,
but
true.
no oncosurgery specific books.
So, what insight I get from this is for the benefit of students, is that if you spend enough time solving the questions repeatedly again and again, because when I spoke to you, you told me that you used to spend a lot of time solving these MCQs. I think that is going to make a hell lot of a difference overall. And did you solve, did you take a specific time to solve questions, or was it like in any way, between OT or between work you used to solve questions?
No, I used to sit on a table to solve the questions. If I'm doing 10 questions also, I'll sit on a chair and with a clock in front of me to solve the question for the time management. Basically, you must do a time management because when you will feel under pressure, your time management will.
True, true, true. Makes sense. Makes sense. I think it makes a lot of sense, Shubham. So, what do you plan to do with this great rank right now?
Abhi to sir, nothing much, but I'm just thinking that where I will get the seat. If I'll opt for the counseling and where I'll go for
Good.
that.
Good. I mean, this particular INSS was a little different from the previous INSS because I think there
Yeah.
was a lot more focus on the basic sciences part. So, is there any topics you would recommend that students focus when they're preparing for INSS surgical oncology?
For surgical oncology, the basic part you must do of general surgery as well. General surgery, the Bailey part is enough for the basics, and for onco surgery, you must do the general basic onco as well. But for the onco specific onco topics, they were more towards the clinical orientation purpose. The questions were clinically oriented, how you will judge. For example, we met a question like a patient came in the emergency with the gastric outlet obstruction, malignant obstruction, and patient the intraoperatively the pancreas was also involved. So, what will be your surgical approach? Like you will do any bypass or you will do any gastrectomy? Like these were the questions, and the two questions were framed on the similar scenario. And one questions the pancreas was involved, in other question pancreas was not involved.
I
Was
get it. I
both
get
the
it.
questions was, but that was just only the clinical orientation. You must know that
Makes sense.
what all the
And to basically understand whether you have read through the guidelines, whether you understood how
yeah
NCCN works, that's exactly what they're trying to test right now, right?
yes sir
I think that's a very useful way of approaching the entire process. So Shubham, I think I'm very glad that you've been here with us today, and I really wish that you get a seat of your choice.
yeah.
And
Thank you, sir.
any specific advice you would like to give the students before we finish?
Yes, sir. I must recommend only one thing that whenever anyone perform any test or do the question bank, they must perform with the time limit and they must jot it down what are their strengths and weaknesses while performing any question. Any
Absolutely.
test, whatever their strengths and weaknesses and what are the remedies for their weaknesses, they must focus on their that remedy part. Every test, they must increase their strength part
Absolutely.
and they do not forget about the strength test. That will the whole, if they have jotted down on a page, they must just before 1 to 2 days or on the day of the exam, they must read it what are their strengths and what are their weaknesses so that they do not mistake during their exams.
True. I think that makes a lot of sense. Thank you so much, Shubham, for being here with us today. I think it was very enlightening to have you here because you have given us a lot of important points. No one has
Thank you,
spoken
sir.
about this before. None of the toppers have spoken about this, but I think it seems like a very sensible strategy. Timing, how you should be, timing is very important when solving MCQs. Thank you so much, Shubham. Wish you
Thank you,
all the
sir.
best in your life. I really
Thank you, sir.
hope that you have a bright future. Wishing you all the very best from the entire search test team. Thank you.
Thank you, sir.